precautions, what about side effects? Are there any foods that you should avoid while taking this drug? What drugs you are currently using that a contraindication. So these are some of the things I want to cover. So that's a lot I want to pack in this presentation. So let's get going, okay? But in order for you to get it, because I just can't go to my doctor and say, hey, I want to lose 20 pounds. I want to lose 30 pounds because I'm trying to get real cute before the holidays. You have to have a weight-related medical condition in order for you to be able to be prescribed this drug by your doctor. And so a weight-related medical condition could be type 2 diabetes, kidney disease, gallbladder disease, fatty liver, or obesity, hypertension. So these are some weight-related medical conditions. And with that, possibly your doctor may say, and it could be other things that your doctor is looking for, but that may make you be a good candidate for taking Ozempic. Now, I like to look at a lot of different sources before I present information to you. I really like the Mayo Clinic, so some of this information I'm getting from the Mayo Clinic, but I definitely look at different sources. What are some of the precautions? So there are some precautions that you want to keep in mind, or your doctor is going to be keeping in mind before you get this drug. Number one, do you have any allergies? Possibly some of the ingredients you could be allergic to. And if it's a child we're talking about, if they're under 12, that's probably not going to work. And if you're breastfeeding, definitely there's just not enough studies that your infant would be safe. So because of that, that could be a precaution. If you're much older and you're elderly or you're seniors, they may be more sensitive to this drug. So that could possibly be a precaution, and your doctor would have to weigh that. There is a massive laundry list of other drugs that could be contraindicated if you're taking Ozempic, a massive amount. So definitely when you are with your health practitioner, be very careful. If I were you, I would write out all the drugs or herbs that you're taking and that your doctor can make a better assessment. In addition to any drug that you're taking, you want to work with probably a dietitian, if a dietitian is on the team, because there's certain foods that you should not be eating or taking when you are on Ozempic. For instance, caffeine, alcohol, high-fat foods, high-sugary foods, processed foods, spicy foods. Now, here's my concern. That's everybody's diet. We all eat those foods. So that's a typical American diet. So definitely my concern is you're going in, you're taking this drug, and you're not letting them know, or, maybe it's being missed. It shouldn't be. What types of foods that you're eating, or you're not getting any counseling regarding that. Because let's just say with the high fatty foods, you like to eat a lot of fat foods, and fat takes longer to digest. Well, when you're taking this drug, Ozempic, it slows down your digestion. And when it slows down your digestion and you're eating foods that take longer to digest, the two coming together can have some bad side effects. And those side effects are not side effects that we want. And so that's a concern for me. In other words, nausea, bloating, vomiting. Those are side effects that when we start having those kind of side effects, we usually want to stay home and just rest up. We're talking about your diet. If you're eating high sugary foods, that could give you a sugar spike, a blood sugar spike. And so if you're a diabetic, you want to lose weight, the last thing you want is to be eating things that would cause you to have a high sugar spike. So as if you continue to eat these high calorie foods and a lot of processed foods, then that's going to do the opposite of what you're trying to accomplish, which is better blood glucose control or better blood sugar control and weight loss. It is strongly advised. The two go together like peanut butter and jelly. It's not just Ozempic. It's not a standalone. It is in conjunction with your diet, and that's why I'm talking about diet, and exercise. And you don't hear that a lot. You just hear, we're taking Ozempic, we're taking this, or we're taking Wegovy, and that's all you hear. But no, these drugs are in conjunction with a sound diet and also with exercise. You definitely want to be monitored closely, and your doctor is going to make the adjustment or let you know for the weight that you are and whatever your activity level is, etc., what dose works for you. And you definitely need to be meeting with your health practitioner so they can monitor it. Because if you get that rapid weight loss, and that's when we see the people with the Ozempic face. Now, the Ozempic face is they have rapid weight loss. They're losing a lot of weight. You see it in their face. So the fatty tissue in your face is being depleted. And now you have that sunk in, gaunt zombie look. Oh, we can't wait to have that look. No, aging skin. Well, some are having to get cosmetic procedures to override that. So I'm just sharing with you, it's not the panacea that you think it is. There are a number of concerns. Other precautions, we talked about one already, is alcohol. Now, if you're drinking alcohol and you're taking this drug, you can get severe low blood sugar. So that is an issue. Definitely, you want to be careful about that. Other precautions are you may get an increased thyroid tumors, pancreatitis in some instances. And pancreatitis is when you get the swelling of the pancreas, which you can get stomach pain, chill, constipation, nausea, vomiting, fever, or lightheadedness. If you have symptoms such as these, nausea, vomiting, stomach fullness, yellow eyes or skin, jaundice look, then we may suspect gallbladder disease. So again, if you're having any of those symptoms, you definitely want to be checking with your physician. Blurred vision. You don't want to, because you're getting the weight loss and you're feeling good. No, but you don't want to dismiss some of these possible side effects from taking this drug. You definitely want to communicate these, write them down, communicate these with your physician. If you're at rest and you're getting this heartbeat, a little bit more rapidly than you should at rest, definitely you want to be checking with your physician. Now here are some side effects. We've talked about some of them with different conditions, but here are some side effects that are the most common. And when we say the most common, we mean, okay, we can't ignore it. Sometimes maybe half the people who are taking this drug experience this. Belching, bloating, constipation, nausea, vomiting, diarrhea, heartburn, indigestion. Now, this is how Ozempic works. It mimics the action of GLP-1 receptor. GLP stands for glucagon-like peptide, number 1. GLP-1 is a gut hormone. This is what happens. So, when you eat your food, your body, the pancreas senses food is there, and it secretes insulin. The insulin is secreted to bring down your blood sugar levels or your blood glucose levels. Now, if it gets too low, you have an antagonist that kicks in to raise it, and that's that glucagon. Well, I know that's a whole lot, but the bottom line is, with Ozempic or any other drug like a semaglutide, it works in conjunction with diet and exercise. So you can't do away with that. So I just wanted to share that with you. I'm Das. Definitely join me in the after party, where I like to talk more intimately with you about things that concern you in the areas of diet and health, focusing on weight loss, sharing with your family and friends, and I hope to see you next show.